Good evening, everybody. Great to be one of our upcoming sessions of OcuHealthscapes. I perhaps will give a minute more for a couple of people who are just settling in, and then we'll begin. All right. So I think in the interest of time, let me begin. First of all, welcome all of you on the 17th episode of OcuHealthscapes. It feels amazing to reflect back and think of the 17 months journey approximately, which we have had on this entire past episodes. I think it's really great and fortunate to have this academic feast comprising of not only updates, but the happenings and the insights and even the best practices which are happening worldwide. So without further ado, let me actually invite the speaker of the day. It's our proud privilege to have with us Dr. Rajiv Kumar Jain, who's the Vice President of AEOHT. Dr. Rajiv is a Senior Consultant Health at Indian Railways, has extensive experience in health and hospital administration. He's a distinguished fellow of several associations and societies, including IPHA, IAOH, Association of Environmental and Occupational Health Delhi. He has had several fellowships, scholarships in international organizations, including WHO, Canadian Society for International Health. He has been a core member for guidelines on medical preparedness of National Disaster Management Authority. He has, to his name, several publications, and he has also been awarded several orations, including the L&T oration in 2015, C.K. Ramchandran Memorial Oration in 2018, the second Indian Oil Oration in 2019. He has in the past been the Director of Health and Family Welfare in Ministry of Railways. He has also been the ex-editor of Journal of Academy of Hospital Administration. So with such a proud legacy of what Dr. Rajiv has, let me invite him to deliver today's deliberations on the OcuHealthscapes. Over to you, Dr. Rajiv.
Thank you, Dr. Ashish, for the kind words that you've spoken. I don't know how much I deserve to be told like that. I feel humbled when you talk like that. But all the same, let's get on to our 17th issue of OcuHealthscapes, the monthly video magazine for updates on local, regional, national, and international updates on environmental and occupational health issues. And this issue, I'm concentrating on the main issue, which is the occupational safety and health, which was celebrated on 28th of this month. And International Labour Organization and experts in the world have now brought out a report which we shall discuss in detail in its various forms and ramifications in the area of occupational safety and health at work, because it has huge implications for our practice of occupational health and occupational safety in the world of work, especially because of the COVID-19 pandemic. And now we can say we are entering a post-pandemic world. We are on the cusp of ensuring that COVID-19 is under reasonable control it is not causing that much damage which it was causing or it hoped to cause in the past. Could I have the next slide, please? Yes, this is the title of the report, which we shall discuss in detail. Enhancing social dialogue towards a culture of safety and health. What have we learned from the COVID-19 crisis? And this report was released on the World Day for Safety and Health at Work 2022 on 28th of April this month by International Labour Organization. Before we proceed further, I would like to share with you a session with Dr. Manal Aziz, who is a lead expert in the area of safety and health in International Labour Organization. So let's hear her first before we proceed further.
Each year, nearly 3 million workers around the world die due to occupational accidents and diseases. Hundreds of millions fall sick or are injured at work. From the onset of the COVID-19 pandemic, workers and employers' representatives in many countries have collaborated to develop workplace policies and strategies to protect people from the virus and from other related risks. This year's World Day for Safety and Health at Work highlights the importance of social dialogue in promoting a positive occupational safety and health culture. Social dialogue refers to all types of negotiation, consultation, and exchange of information between representatives of workers, employers, and governments, and other actors on common issues. This is the most effective way of reconciling competing interests and implementing policies. The report shows that when governments, employers, and worker organizations work together, they pool their knowledge to develop and implement laws, policies, and interventions that help safeguard workers throughout the crisis. A positive occupational safety and health culture is built on open communication and dialogue between workers and employers. Workers must feel comfortable airing their concerns about possible risks and hazards in the workplace, and management must actively address those issues. There are many examples. In Canada, for instance, workers and employers' representatives work together to create COVID-19 mitigation plans, including screening processes and contact tracing. In South Africa, discussions between government employers and worker representatives led to measures aimed at reducing the spread of the virus in workplaces. In Italy, on the other hand, social partners in the banking sector created detailed rules on telework, including the right to privacy and the right to disconnect. When workers take part in promoting safe and healthy workplaces, it reduces the risk of accidents. We found that workplaces with higher worker engagement report 64% fewer safety incidents and 58% fewer hospitalizations. Work-related accidents and diseases can and should be prevented. Building a culture of prevention through social dialogue will contribute to healthy workforces, productive enterprises, and sustainable economies.
So friends, you've seen the importance of the social dialogue for enhancing occupational safety and health at work, and how COVID-19 has helped us in understanding or reinforcing the fundamental importance of social dialogue. Could we have the next slide, please? Yes, next slide. Yes. It is a substantial evidence available. Around 2.9 million workers die every year due to occupational accidents and diseases, and at least 402 million people suffer from non-fatal occupational injuries. Even examining 41 pairs of specific risk factors and health outcomes, the WHO-ILO joint estimates indicate that work-related diseases were responsible for 81% of all work-related deaths, with deaths due to occupational injuries accounting for the remaining 19% of work-related deaths. The occupational risk factor with the largest number of attributable deaths was exposure to long working hours, resulting in 745,000 related deaths, followed by exposure to particulate matter, gases and fumes, resulting in 450,000 deaths. Not only do occupational injuries and illness cause immeasurable human suffering to victims and their families, they also entail major economic losses for the enterprises and economies as a whole, which may be measured in terms of healthcare costs, compensation costs, production losses, reduced work capacity, and lower workforce participation. Occupational accidents and disease are estimated to contribute to 5.4% of annual global gross domestic product, that is GDP, lost. Less tangible costs contribute towards broadening the economic impact. These include presenteeism, that is working with less effectiveness and productivity losses associated with permanent impairment, and staff turnover costs, that is loss of skilled staff. Over 300 million workers interviewed from 142 countries stated that they feel they cannot report safety issues to their employers without fear of punishment. This lack of reporting can lead to serious preventable injuries due to fear. Conversely, workplaces with higher worker engagement reported 64% fewer safety incidents and 58% fewer hospitalizations. Giving appropriate priority to the prevention of occupational accidents and diseases and providing adequate investments in occupational safety and health, that is OSH, will contribute to sustainable economies, thereby ensuring a healthy workforce and supporting productive enterprises. To this end, it is essential to create a preventative safety and health culture as defined by the Promotional Framework for Occupational Safety and Health Convention 2006, that is number 187. Could we have the next slide, please? Yes. The benefits of a positive OSH culture. We shall discuss this, but before we go ahead, I would again like you to have a look at the video now, where we talk of what is OSH.
It stands for Occupational Safety and Health, and it means the prevention of work-related injuries and diseases, as well as the protection and promotion of workers' physical and mental health. Almost 3 million people die every year due to exposure to safety and health hazards at work. That's more than 5 people dying every minute. In addition to the suffering caused by accidents and diseases at work, there is a significant economic cost for workers and their families, employers, and economy as a whole. When we arrive at the workplace, we expect to be safe. Occupational safety and health measures are applied in our daily work life to protect you, regardless of whether you work at home, in an office, construction site, or hospital. Nearly half of ILO labor standards deal with occupational safety and health. In addition, the ILO works in over 140 countries to encourage strengthening national OSH systems through effective laws and social dialogue, collecting data, and staying up to date with research. Safety and health at work is everyone's concern.
So you've seen how simple the concept of occupational safety and health is. So to understand further the benefits of a positive OSH culture, even if there is not one single definition of workplace OSH culture or safety culture, it may be described as a product of individual and group values, attitudes, perceptions, competencies, and patterns of behavior that can determine the commitment to and the style and proficiency of an organization's health and safety management system. This is the definition given by Health and Safety Commission in 1993. An OSH culture has psychological, behavioral, and situational component. The psychological component consists of shared values, attitudes, perceptions, and beliefs that drive decisions and behaviors regarding safety. The behavioral component may be defined as the method regarding safety in the workplace, and the situational component as the policies, procedures, regulations, organizational structures, and management systems related to safety. A positive OSH culture is characterized by different elements. First and foremost, OSH should be considered and clearly communicated as a value and be integrated into every aspect of the enterprise's dealings. Leadership is the highly visible commitment to OSH by employers and top management and is key to developing a positive OSH culture. Workers' perceptions of senior managers' attitudes and behaviors in relation to OSH will form the basis for their safety behavior and hence the enterprise's OSH performance. While positive OSH attitudes at the top management level are essential for the positive OSH culture, it is vital that these attitudes be transmitted to subordinates so that they might accurately perceive them. Communication, particularly frequent and open contact between managers and workers, therefore plays an important role in developing a positive OSH culture and attaining good OSH performance. To create and enhance a positive OSH culture, OSH training and information should be provided to all workers so that they can actively participate in actions to improve safety. Workers should learn from insight and intuition rather than incidents and change their ways of thinking and acting by sharing their experiences and addressing shared problems. Enhancing a positive OSH culture in the workplace significantly contributes to reducing work-related accidents and diseases, as well as to improve workers' well-being and morale. Healthier and happier workers will, in turn, contribute to improved business productivity, quality, and profitability. So these are so important aspects of OSH culture contributing towards benefit of the society. Next slide. Now, the second aspect is the aspect of social dialogue. There are various forms of social dialogue. Social dialogue can exist as a tripartite process with the government, that is Ministry of Labor, and or other ministries concerned as an official party to the dialogue. When dealing with issues beyond the world of work, the dialogue often involves other actors representing specific concerns and interests of the civil society. This may take the form of a tripartite plus process. Experts may also be involved in such processes, both as members or for consultative purposes. Social dialogue can also consist of bipartite relations, which only exist between labor and management, or employers and workers organizations, with or without government involvement. Bipartite social dialogue includes collective bargaining and workplace cooperation. Collective bargaining is at the heart of the social dialogue and consists of all negotiations which take place between an employer, a group of employers, or one or more employers organizations on the one hand, and one or more workers organizations on the other, for determining working conditions and terms of employment and regulating relations between employers and workers and regulating relations between employers or their organizations and workers organizations or workers organizations. Collective bargaining may take place at different levels, including national, sectoral, local, and workplace levels. Now, for workplace cooperation may take a variety of forms, ranging from informal information sharing to consultation or joint decision making. By building trust and confidence between workers and management, workplace cooperation fosters the improvement of working conditions and the working environment. It contributes to a more motivated and productive workforce and more competitive and profitable enterprises, improving enterprise performance from every standpoint. There are various forms of social dialogue. Since its creation in 1919, social dialogue has been one of the founding principles of the ILO. Employers, workers, and government take part in all discussion and decision-making on the international labor matters, with a view to establishing a universal and lasting peace and promoting social justice and decent work for all. This tripartite structure is a feature of the ILO, making it unique within the United Nations system. Social dialogue is embedded in the ILO constitution and almost all international labor standards, as it is perceived as a key method to achieve sustainable decisions and peaceful workplace relations. In 1976, the ILO adopted the specific convention that promotes tripartism, namely the Tripartite Consultation International Labour Standards Convention 1976 number 144. It requires effective consultation between the government, employers and workers' organizations at each stage of the standards-related activities of the ILO on matters ranging from the setting of the agenda of the International Labour Conference, the ratification of international labour standards, the supervision of the application of standards, to the denunciation of ratified conventions. With the adoption of the ILO Declaration of Fundamental Principles and Rights at Work in 1998, all ILO member states have the obligation arising from their membership of the organization to respect, promote, and realize the fundamental principles and rights at work contained in the 8 fundamental conventions, which include the right of freedom of association and effective recognition of the right to collective bargaining. The freedom of association and protection of the rights to organize convention 1948, that is number 87, recognizes the right of workers and employers to freely establish and join organizations of their own choosing, and states that the public authorities should refrain from any interference which would restrict the rights or impede its lawful exercise. This convention is complemented by the right to organize and collective bargaining convention 1949, that is number 98, which provides for the establishment of measures to ensure respect for the right to organize and encourage development of collective bargaining. Another related standard is the Collective Bargaining Convention 1981, which is number 154, which defines the parties to collective bargaining and the purpose of the negotiations. A number of recommendations provide further guidance and the promotion of social dialogue at different levels. These include 51, that is number 91, the cooperation at the level of the undertaking, recommendation 1952, that is number 94, the consultation, industrial and national levels, recommendation 1960, that is number 113, the communications within the undertaking, recommendation 1967, number 129, the examination of grievances, recommendation 1967, that is number 130, the tripartite consultation activities of the ILO, recommendation 1976, that is number 152, and the collective bargaining recommendation 1981, that is number 163. The relevance of social dialogue to building up social cohesion and a productive economy has been reiterated in ILO's landmark declaration, such as the ILO Declaration on Social Justice for a Fair Globalization on 2008, and the ILO Centenary Declaration for the Future of Work in 2019. Social dialogue is also key in crisis response, as clearly shown by the COVID-19 pandemic. In this regard, one of the most recent ILO standards, that is the Employment and Decent Work for Peace and Resilience Recommendation 2017, that is number 205, outlines a strategic approach to crisis response, which should promote safe and decent working conditions through social dialogue. Now, we take a look at the European Economic and Social Committee adopted the exploratory opinion, that is social dialogue as a tool to promote health and safety at work, which is SOC number 703. At its 566th plenary session held on 19th and 20th January 2022, the European Economic and Social Committee, EESC, adopted the opinion, the social dialogue as a tool to promote health and safety at work. In this exploratory opinion requested by the French presidency of the European Union, the EESC sees social dialogue, that is SD, as instrumental in achieving the 3 key objectives: anticipating and managing change in the world of work brought about by the green, digital, and demographic transitions, improving prevention of workplace accidents and work-related illnesses, and third, and being prepared for any potential future health crises. The committee recognizes that the pandemic is an opportunity to create a new collective ability to tackle future crises and mitigate their impact on OSH. The recovery plan should make it possible to strengthen the role of the social partners in the member states where they have the least influence. The EESC calls for a culture of prevention to be developed. This should involve training the parties involved in the social dialogue, raising awareness of emerging risks, and bolstering and disseminating the resources available. The EESC also considers that agreements between the social partners shall be implemented in the member states and asks the Commission to discuss with the social partners the implementation of autonomous agreements and the process of joint request for council decision, respecting the autonomy of the social partners and following the procedure of Article 155 of the Treaty on the Functioning of the European Union, that is the TFEU, which is the Treaty on the Functioning of the European Union. So you can understand how important it has become post the pandemic situation. Now we take a look at the tripartite OSH bodies and social dialogue in 6 countries of Latin America. The ILO technical report on technical social dialogue on OSH and the regulatory frameworks, progress and challenges in 6 countries in Latin America. Describe the existing regulatory framework of the tripartite OSH bodies in these countries, that is Argentina, Brazil, Costa Rica, Mexico, Peru, and Uruguay. It describes the outstanding results achieved as a result of tripartite social dialogue on OSH in each country and contains an overview of the areas in which they are currently working, as well as a mention of their future challenges. The study highlights the importance of comprehensive and up-to-date regulatory frameworks on social dialogue on OSH, including internal operating regulations, to facilitate its smooth functioning, and it clearly demonstrates how tripartite social dialogue on OSH in these countries remained very active during the pandemic. Although some of the items of discussion focused on prevention from COVID-19 at the workplace, others covered issues such as chemicals, heat stress, psychosocial risks, including violence, national OSH policies and programs, and promotional campaigns. The report highlights the important opportunities that have arisen for OSH as a consequence of the pandemic and the role that tripartite social dialogue can play in this area. Now, we take another aspect of the OSH culture, that is prevention pays. Although employers primarily improve their OSH measures to meet their statutory requirements and fulfill their social and ethical responsibilities towards their workers, there is no denying that they reap an economic benefit from investing in the prevention of occupational accidents and diseases. It is well established that occupational accidents and diseases are bad for productivity. The direct costs that they can entail for enterprises are related to the disruption to their business and ongoing lost production from a worker's absence, the ensuring insurance and the compensation costs, and a possible increase in insurance premiums, fines, or legal proceedings following an accident or a case of ill health. In addition, any damaged equipment might have to be replaced or repaired. Furthermore, the indirect costs for enterprises, usually harder to quantify, are estimated to be much greater than the direct costs. These might include costs associated with the absence of the injured worker, replacement, overtime, loss of production, reorganization of work, an additional loss of working hours other than those resulting from the injury itself through repairs and cleaning, helping the injured first aid, interruption of work, a lower motivation to work and workforce morale, increased absenteeism and presenteeism, the last but not the least, a loss of reputation and negative public relations. It should be stressed, however, that providing safe and healthy working conditions actually makes enterprises more productive. The traditional attitude, which considered that any improvements to workplace health and safety represented an additional financial burden, is gradually being replaced by one that views workers' health, safety, and well-being as an integral component of an enterprise's economic sustainability and organizational development. A growing number of successful enterprises have shown that it is possible to combine workers' well-being and enterprises' profitability in a balanced way by linking OSH with managerial and developmental issues through OSH management systems. In many countries, enterprises have started to pay more attention to prevention, realizing that investing in OSH brings economic and social benefits, contributing to efficiency, productivity, and competitiveness. A study from DGUB on the international return on prevention for enterprises shows that expenditure on OSH is an investment that pays off, with a return on prevention, that is ROP, estimated at 2.2. In particular, the three most significant benefits were found to be added value generated by increased employee motivation and satisfaction, added value generated by a better corporate image, and cost savings through prevention of disruptions. So there is substantive evidence that prevention pays. Now we take a look at another aspect of occupational safety and health at work. That is the Occupational Safety and Health Convention 1981, number 155, and its accompanying recommendation number 164, define the basic OSH rights and responsibilities of workers and employers that should be included in national legislation. All of these are also essential in the prevention and mitigation of the negative safety and health effects of pandemics such as COVID-19 in the world of work. The employers' responsibilities and workers and their representatives' rights and responsibilities. The responsibilities of employers are required to ensure, so far as is reasonably practicable, that the workplace's machinery, equipment, and processes under their control are safe and without risk to health. Ensure, so far as is reasonably practicable, that the chemical, physical, and biological substances and agents under their control are without risk to health when the appropriate measures of protection are taken. Provide, where necessary, adequate protective clothing and protective equipment to prevent, so far as is reasonably practicable, risk of accidents or of adverse effects on health. Such personal protective clothing and equipment should be provided without any cost to the worker. Provide, where necessary, for measures to deal with emergencies and accidents, including adequate first aid arrangements. Ensure that there are arrangements in place in which workers and their representatives are consulted, informed, and trained on OSH associated with their work. With respect to workers and their representatives, first are the rights. Workers are entitled to receive adequate information and be given training in OSH. And they are also entitled to inquire into and be consulted by the employer on all aspects of OSH associated with their work. They are also entitled to remove themselves from a work situation which they have reasonable justification to believe presents an imminent and serious danger to their life or health without undue consequence. The workers and their representative responsibilities. Workers are required to cooperate with the employer in the field of OSH. They are also required to take reasonable care for their own safety and that of other persons which may be affected by their acts or omissions at work. They are also required to comply with instructions given for their own safety and health and those of others. They are also required to use safety devices and protective equipment correctly and not render them inoperable. They are also required to report forthwith to their immediate supervisor any situation which they have reason to believe could present a hazard and which they cannot themselves correct. They are also required to report any accident or injury to health which arises in the course of or in connection with work. Now, this is an important diagram. This is the reality of today. The workers reporting safety issues to employer, a global picture. A meaningful bipartite discussion at the workplace is paramount to establishing a preventative OSH culture. However, according to the Lloyd's Register Foundation World Risk Poll 2019, conducted by Gallup in 142 countries, over 300 million workers feel they cannot report safety issues to their employers without fear of punishment. This absence of discussion is a serious safety and health risk at the workplace. It was found that the injury rate due to fire increased by over 40% in establishments where workers fear to report safety issues, followed by a 23% increase to exposure to chemicals or biological substances, compared to establishments where workers feel free to report any safety problem without being penalized. The colors, could we go to the, yes, proportion of workers who do not agree two statements. You are free to report any safety problems you notice to your employer without fear of punishment in percentage. You see the scale of color at the bottom. The from left is blue and the right is yellow. The more yellow means more proportion of workers who do not agree to the statement. That means they are not free. So more yellow means bad condition. And you look at Pakistan, it is completely yellow. And India is to a better condition, it's orange. But you look at the Canada is the best, that is blue. You look at the Northern Europe, especially Scandinavian countries, it is also blue. And in Europe, UK and Portugal, Spain, and France also are the best countries in terms of workers reporting safety issues to the employers. And the benefits are very visible. Now we come to rights and powers of workers, OSH representatives in detail. Facilities. Facilities in the undertaking shall be afforded to workers' representatives as may be appropriate in order to enable them to carry out their functions properly and efficiently. Time off. Workers' representatives in the undertaking should be afforded the necessary time off from work without loss of pay or social and fringe benefits for carrying out their representation functions in the undertaking, as well as for attending trade union meetings, training courses, seminars, congresses, and conferences. Information. There shall be arrangements at the level of the undertaking under which representatives of workers are given adequate information on measures taken by the employer to secure OSH and may consult their representative organizations about such information, provided they do not disclose commercial secrets. Workers' OSH representatives should be given adequate information on safety and health matters, enabled to examine factors affecting safety and health, and encouraged to propose measures on the subject. Training at no cost. There shall be arrangements at the level of the undertaking under which workers and the representatives in the undertaking are given appropriate training in occupational safety and health. Occupational safety and health measures shall not involve any expenditure for the workers. Next is access to workplaces and workers. Workers, OSH representatives in the undertaking should have access to all parts of the workplace and be able to communicate with the workers on safety and health matters during working hours at the workplace. Next is access to management. Workers, OSH representatives should be granted without undue delay access to the management of the undertaking and to management representatives empowered to take decisions as may be necessary for the proper exercise of their functions. Cooperation with the employer. There shall be arrangements at the level of the undertaking under which representatives of workers in the undertaking cooperate with the employer in the field of occupational safety and health. The measures taken to facilitate cooperation should include, where appropriate and necessary, the appointment in accordance with national practice of workers' safety delegates, of workers' safety and health committees, and or of joint safety and health committees in joint safety and health committees. Workers should have at least equal representation with employers' representatives. We come to inquiries and consultation now. There shall be arrangements at the level of the undertaking under which workers or their representatives, and as the case may be, their representative organizations in an undertaking are enabled to inquire into and are consulted by the employer on all aspects of OSH associated with their work. Workers' OSH representatives should be consulted when major new safety and health measures are envisaged and before they are carried out, and seek to obtain the support of the workers for such measures. They should be consulted in planning alternatives of work processes, work content, or organization of work which may have safety or health implications for the workers. Participation in decision-making is also important. Workers' OSH representatives should be able to contribute to the decision-making process at the level of the undertaking regarding matters of safety and health, and be able to contribute to negotiations in the undertaking on occupational safety and health matters. Posting, notice, and distribute union material. Workers' representatives acting on behalf of trade union should be authorized to post trade union notices on the premises of the undertaking in a place or places agreed on with the management and to which the workers have easy access. The management should permit workers' representatives acting on behalf of the trade union to distribute news sheets, pamphlets, publications, and other documents of the union among the workers of the undertaking. Access to labor inspectors. Workers' OSH representatives should be free to contact labor inspectors. Access to external expertise. Workers' OSH representatives should have recourse to specialists to advise on particular safety and health problems. So this is so important, and these rights are important to provide to OSH representatives. Next slide. Now, we come to building a strong and positive OSH culture at the workplace level. A positive OSH culture is one in which management and workers value the right to a safe and healthy working environment and actively participate towards this end. It is built on open communication and dialogue between workers and employers, where workers feel comfortable sharing their thoughts about incidents and concerns. Leadership and commitment to OSH by employers and senior management are crucial to creating a positive OSH culture. In fact, the perception of senior managers' attitudes and behaviors in relation to OSH will form the basis for the OSH behavior of workers and thus the OSH performance of the enterprise. 7 core values have been identified as important for the development of a positive OSH culture. That is social involvement, participation, justice, resilience and flexibility, trust, development and growth, and sustainability. Each of these core values is important for the development of a positive OSH culture, and each can have a direct and indirect influence on OSH. At the same time, they also contribute to the business success of an enterprise. Enterprises with a positive OSH culture have a safety information system that collects, analyzes, and disseminates information from incidents and near misses, as well as from regular proactive checks on the system. They have a reporting culture where people are prepared to report their errors, mistakes, and violations. They have a culture of trust where people are encouraged and even rewarded to provide essential safety-related information, but also in which it is clear where the line between acceptable and unacceptable behavior is drawn. They are flexible in terms of the ability to reconfigure the organizational structure in the face of a dynamic and demanding task environment. They have the willingness to competence to draw the right conclusion from its safety system and are willing to implement reform when it is required. Now, these are different stages of development of OSH culture. You see from the top, pathological, which is employers and workers do not care about violating safety rules. That is no care OSH culture. Second is reactive. That is safety becomes important only after an accident. That is blame OSH culture. Third one is calculative OSH culture. In this, systems are in place to manage all hazards. This is known as planned OSH culture. Fourth one is proactive. Workers do not work on problems they find, but avoid problems in advance to improve the work environment. And the best one, that is the generative. This culture as OSH is built into ways of working and thinking, creating a dynamic OSH culture. Through well-managed organizational changes built on the foundation of social dialogue, enterprises may transform toward a positive OSH culture. Next slide. Now, this seems to be a very complicated diagram, but it is simple. At the core is audit, which is continuous audit. Continual improvement is the next blue line you see, a circle, in which policy, organizing, planning and implementation, evaluation, and action for improvement are inbuilt in the cycle. In that order: policy, organizing, planning and implementation, evaluation, and action for improvement. For each part of this cycle, you have in organizing, you have responsibility and accountability, OSH competence, OSH documentation, and communication. In planning and implementation, you have initial review, hazard prevention, emergency prevention, preparedness and response arrangements. In evaluation, you have investigation of work-related injuries, diseases and incidents, and their impact on OSH performance. You have audit and you have management reviews. In action for improvement, you have continual improvement process. In policy, you have OSH policy and workers' participation. So this process, this becomes a continuous improvement process. The social partners encourage COVID-19 risk assessments in Indonesia for MSMEs and the hospitality industry. During the COVID-19 pandemic, almost all enterprises have been impacted and suffered losses. Micro, small, and medium enterprises, that is MSMEs, and the hospitality industry are among some of the enterprises that have been hardest hit by the pandemic and its effects. Two employers organizations in Indonesia, the Indonesian Employers Association, that is IPINDO, and the Indonesian Hotel and Restaurants Association, that is PHRI, are in partnership with the ILO, encouraging their enterprises members in Jakarta to take advantage of a free COVID-19 risk assessment service based on the Indonesian national guidelines for operating safety during the pandemic. The free risk assessment project also includes advice from OSH doctors who can advise enterprises on steps to take following their risk assessment. Furthermore, the Ministry of Manpower and various trade union confederations are included as key partners in the project's development and implementation. The risk assessment service has been provided free of charge to over 1,500 workplaces across Indonesia. The ILO Participatory Action-Oriented Training Approach, that is PAOT. The Participatory Action-Oriented Training methodology was originally developed in the 1980s to disseminate good practices and solutions for helping overcome the constraints typically experienced by grassroots organizations, such as a low budget, limited managerial capacity, and limited logistic means. Over the years, the ILO has developed a series of training programs using the PAOT approach, in which employers, managers, and workers, including farmers, are empowered and supported to improve OSH working conditions and productivity. Based on a self-assessment conducted by walking through the workplace and using PAOT action checklists. Participants can identify OSH priorities and develop creative and practical ideas using locally available resources. The participatory approach emphasizes the need for the participation of both the employer and the workers' organizations to ensure the continuous improvement of OSH conditions and productivity. PAOT includes several techniques encouraging mutual advice and collaboration between employers and workers and their representatives, but also among the different enterprises, benchmarking, meeting and discussing with others, or visiting their working environment provide better or broader perspectives. Next slide. The global call to action for human-centered from the COVID-19 crisis, that is inclusive, sustainable, and resilient, the centrality of the social dialogue to protect all workers. And this includes inclusive economic growth and employment, protection of all workers, universal social protection, and social dialogue. The call to action recognizes the role that social dialogue, both bipartite and tripartite, has played in the immediate response to the COVID-19 pandemic in many countries and sectors, and its importance to support delivery of the outcome it sets out, including through governments consulting with social partners on designing and implementing national recovery plans and policies addressing the need for retention and creation of decent works, business continuity, and investments in priority sector areas. This was in June 2021, where the International Labour Conference, government, employers, and workers, delegates from 181 countries unanimously adopted this global call to action for a human-centered recovery from the COVID-19 crisis that is inclusive, sustainable, and resilient. Now, at this stage, I would like you to have a look at the video where how we manage the transition is shown, because that is the only way forward for the mankind at this point of time in the pandemic. Let's have a look at the transition management.
need action on climate change. But reducing human activity that damages the environment might also mean a loss of jobs and the need for people to reskill for new job opportunities. A just transition means that people are helped to face these changes as the world moves to a greener future. Climate change is happening now, and the need to change to a greener and low-carbon economy is urgent. But we need to ensure that this transition does not leave people behind. Tackling the climate crisis will involve transforming our economies and societies, so we need policies that ensure the transformation is good for people, the planet, and the economy. The change to a greener economy has the potential to create millions of jobs and promote social justice. But people will also need to adapt. Learning the skills required by new green jobs will be important for young people and those already working. That's why strong education systems alongside unemployment benefits and other types of government support that we call social protection are so important. A just transition is possible and matters for all countries.
So it is so important to manage, expect changes that are very challenging seemingly, but they can be managed if handled properly. So now, after the social dialogue for enhancing social occupational safety and health at work, we come to another aspect, that is 5th of May 2022 is the World Hand Hygiene Day, where World Health Organization will be organizing a webinar at 5 p.m. Indian Standard Time, that is 5th May, 5 p.m. Where when people seek healthcare, they are hoping to get better. Too often, however, they end up getting a new avoidable infection, which is often resistant to antimicrobials and can sometimes even be fatal. When a health facility's quality and safety climate or culture values hand hygiene and infection prevention and control, this results in both patients and health workers feeling protected and cared for. That is why the World Hand Hygiene Day, that is WHHD, theme for 2022 is a healthcare quality and safety climate or culture that values hand hygiene and IPC. And the slogan is Unite for Safety, Clean Your Hands. Unite for Safety, Clean Your Hands. This webinar will bring together experts from WHO and from academic institutions and leaders from the field to discuss how a strong institutional quality and safety culture, safety climate or culture that values hand hygiene and IPC is a critical element of effective strategies to reduce the spread of infection and antimicrobial resistance. New evidence on this, as well as priorities for research in this area identified by WHO, will be presented. With the help of a facilitator, participants will have the unique opportunity to dialogue with expert panel and bring their experiences. The webinar will also be the exceptional moment for the launch of the first WHO Global Report on IPC. Now is the time to unite by talking about and working together on an institutional safety climate that believes in hand hygiene for IPC and high quality safe care. Next slide. Objectives of this webinar are to overview the new WHO hand hygiene research agenda and evidence on the role of a healthcare quality and safety climate or culture for hand hygiene improvement. Second is to describe a range of experiences regarding the evidence for and efforts to support a healthcare quality culture and safety climate through clean hands and IPC programs of work. And third is to launch the first WHO Global Report on IPC. So block your time at 5 p.m. on 5th of May 2022. I've given you the Zoom meeting ID and the passcode on your screen. So remember this, 836-4831-5125. And the passcode is 046806. And you can join in directly as well, or you can go to the WHO website and register through that. Now, at this juncture, I would like you to have a look at another video where upcoming new vaccines for COVID-19 are discussed in a very simple manner. Upcoming new vaccines.
We are talking about vaccines today. What are the vaccines in the pipeline? Are they going to be fast-tracked like we saw with the COVID-19 vaccines? And how are we going to turn these life-saving vaccines into vaccinations? Hello and welcome to Science in 5. I'm Vismita Gupta-Smith. Our expert today is Dr. Catherine O'Brien. Welcome, Kate. Let's start with the vaccines that are in the pipeline.
That's such a great question, Vismita. We've seen the rapid development of COVID-19 vaccines over the past 2 years, and there is a whole pipeline of products that are coming through that aren't against other germs other than COVID-19. They really fall into two categories. The first is vaccines for germs that we don't have vaccines for. And the primary ones that we're pursuing in that group are vaccines against RSV. That's a virus that is one of the most common causes of serious lung disease in young children and infants. It comes through in waves on an annual basis in pretty much every country around the world. Another of the new vaccines that we don't have a product yet for is Group B strep. That's a germ, a bacteria that causes very serious infections in young infants and leads to death in young infants. And so this is obviously an important target to prevent meningitis in infants and protect the lives of newborns. We also have vaccines that are still being pursued against viruses for which we don't have a vaccine, HIV in particular. Then there's the other category of vaccines, ones that we already have, but we're pursuing improved vaccines. And in that category, we're looking very seriously at tuberculosis vaccines, second-generation tuberculosis vaccines. In that category are also improved influenza vaccines. And of course, second-generation COVID vaccines are also in development.
Kate, with COVID-19 vaccines, we saw a fast-tracked process. Can we expect the same with these upcoming vaccines?
Well, COVID-19 was very special, and it was, you've probably all heard this term, unprecedented. We keep calling the development of COVID-19 vaccines unprecedented. And the reason that we shouldn't necessarily expect that the pace of vaccine development will go as quickly as it did are for several reasons. First of all, the whole world was turned on to the pursuit of developing COVID-19 vaccines. There was a complete coordination and collaboration, and practically every laboratory and scientist that worked on vaccine development, both in companies that manufacture vaccines and in academics and other research institutes, were pursuing COVID vaccines. So that's not the way it normally works for vaccine development. The second reason is that the amount of funding that goes into vaccine development was enormous and unprecedented for COVID vaccines. And the third reason that these were so fast and so successful was that there was an infrastructure for clinical trials around the world that was used and turned over to COVID-19 vaccine development. So it was really that there was this one target that everybody was pursuing. So for these other vaccines, we wouldn't expect that they would go nearly as quickly. However, I think because of all the different ways that clinical development of vaccines happened during COVID-19, people are really learning the lessons from that and looking at the steps that can be shortened or run in parallel so that we can actually shorten the amount of time and the amount of effort and investment it takes to bring some of these life-saving vaccines actually to availability.
Kate, we know that governments around the world are working hard to provide access to these vaccines. Speak to us about how these upcoming vaccines will be turned into vaccination.
You know, it's commonly said that vaccines don't save lives, vaccinations save lives. And so a vaccine is really of no benefit if it sits on the shelf and doesn't actually get deployed. Now, there are lots of reasons why vaccinations don't happen, even though vaccines are available. Some of the reasons why is simply the convenience of the services. They're not at the time or the place or the distance where it's easy for really busy people, especially busy mothers, to take their kids or their adolescent teenagers to get vaccination. It's also a problem for older adults. Now, another reason why vaccines don't turn into vaccinations, we've heard a lot about vaccine hesitancy or people who are opposed to vaccination. And I want to really debunk a myth that somehow this is a big group of people. In fact, people who are opposed to vaccination is a very small fraction of people who don't get vaccinated. And usually they're operating under some misinformation that's been shared with them. But there is another group of people who are hesitant about vaccines. They may have questions about how safe do we know that vaccines are, and what is the way that vaccines work. Again, a lot of misinformation among people about exactly what vaccines do when you receive a vaccine. And I want to just reinforce that vaccines stimulate your own immune system, your body's natural immune system, to develop protections against the germ that is actually being vaccinated against, so that when you may be exposed to that germ in the future, in a real life setting, your body already has defenses to protect against it.
Thank you, Kate. If you have any questions about vaccines, please visit our website. Remember, vaccines save lives. Until next time then, stay safe, stay healthy, and stick with science.
So it is important to know the fast-paced development following COVID-19 vaccination development in a range of vaccine which are in development at the moment. So it will get further hastened in the months and years to come. Another event which you would like to participate free on the net is on 9th May 2022, which is again an online event, meaning behind indicators of the subjective employment perspective of older workers. This is organized by ICO Scientific Committee on Aging and Work. Quantitative retirement research investigating older workers and their transition into retirement is interested in the workers' anticipation of future employment. The term subjective employment perspective is covering subjective indicators as preferred retirement age, planned retirement age, expected retirement age, and age being able to work to. In a population, the mean preferred retirement age is usually far below statutory retirement age. While the workers plan to work longer and on average report to be able to work even longer, often these indicators are used as proxies for future real retirement age. But are they valid proxies? Which indicator predicts real exit best? What else do the indicators tell us in the retirement research? Two experts who have worked with these indicators, that is Subhash Newpane and Tampere University, Finland, and Moritz Hess from Hochschule near Germany, will exchange on this topic together with the participant. The Zoom link on the webinar is on your screen. That is Zoom meeting ID is 9356 965 and you can directly go and join the webinar on 9th of May 2022. So CET, that is Central European Time, would be 11 a.m. to 12 noon. So do join in this webinar on 9th of May, and you can register at the website of ICO through the website link, and you can register directly over there. On 21 to 24 August 2022 in Denmark, a hybrid event in the city of Odense in Denmark will be organized on public and occupational health in sustainable agriculture. This is organized by ICO Scientific Committee on Rural Health, DASM, Odense University. It is sponsored by Odense University Hospital, University of Southern Denmark, DSED, and is supported by CG's NGO Dialogue, University of Southern Denmark, University of Aarhus, International Society of Agriculture Safety and Health, Leibniz Institute for Agriculture and Safety, Swedish University of Agriculture Sciences, Northeast Center for Occupational Health and Safety, Agriculture, Fishery and Forestry, NEC in New York, International Center for Rural Health, University of Milan, Scientific Committee, Rural Health, Agriculture, Pesticides, Organic Dust, and High Plains, Intermountain Center for Agriculture, Health and Safety, Colorado State University, ISSA, International Social Security Association, Section on Prevention in Agriculture, International Association of Agriculture, Medicine, and Rural Health, And the topics will be surveillance, diagnosis and prevention of occupational diseases and injuries, musculoskeletal disorders, pulmonary diseases, stress and other psychological distress, exposure hazards and toxic effects of hazard substances, pesticides and others, cancer, hearing loss, infections, for example, COVID-19 zoonosis, health issues specifically affecting women and children, reproductive health and child labor, community health, effects of air pollutants and other exposure to hazardous substances in agriculture communities among consumers, and climate-wise agriculture. And the website is given at the bottom. You could go to this website and get further information, register or present papers at this conference. Before we proceed further, I would like to share with you another video on an important aspect, that is WHO guidelines on clinical management of exposure to lead, which has been released about 10 days back. So these are voices from that clinical guidelines. So let's have a video, because lead exposure is an important risk that everybody faces. Sound is to be there also. Kindly ensure sound is there. You will hear in this video how important it is to diagnose lead poisoning early, even in children and adults, and what are the problems that may happen in human beings if not detected early. It can lead to a lot of disability, a lot of morbidity and mortality, which is fully preventable if we are aware that lead toxicity can be prevented. And if not prevented, the persons who suffer from lead toxicity are detected early and are managed according to international principles of clinical management of lead toxicity. And these are important aspects which require management at all levels. All clinicians, all occupational physicians should be aware of this problem, especially in the paint industry. There are a number of areas where lead exposure does occur in India. And whatever regulations are there, they are still to be fully complied with. That with the result that people suffer from lead toxicity. Could we have the video now? Yes. So video is there.
I remember some cases early on in the United States and Massachusetts where there was very little knowledge in the pediatric healthcare community about how to treat children with high blood lead levels. And I especially remember two little boys. Now, I was in the public health department. I never met these children, but the two little boys were never treated. They had blood lead levels. Now we would put them in the hospital and they'd stay there for a week, but they walked around with blood lead levels should be less than 5, on average about 60, or one of them average about 80 for the other for years. And they did not come out of that without any impact. I mean, they've had significant impacts on their life as a result of that. Now that these children are in their mid-30s and they've been to jail several times and they didn't graduate from high school and all the things that we say. And I just remember them, and I think about them a lot.
The first was 2 cases of patients with lead poisoning when I was a junior doctor in training, in which the diagnosis of lead poisoning was not immediately apparent. And these really illustrated the potential for lead to cause significant problems throughout the body in many different body systems, and the fact that the diagnosis can often be a difficult one to reach, and that there's a need for increasing awareness of lead as a clinical problem.
I will pick up a group of cases who come to me with like abdominal pain, the symptoms are severe abdominal pain, constipation, or even they have been hospitalized for that. And there is a lot of investigations have been done, so much so that even they have undergone CT scans, colposcopies to rule out cancers. And finally, something strikes the doctor and he gets a blood lead level done.
In one instance, more or less at the same time as I am talking to you, there's a small 3 months young baby which was brought to me with convulsions. By the time we measured the blood lead level, the child was no more. It had convulsions. It had died in my arms. That I cannot forget. I had decided there might be millions of such children in developing countries because the child's parents were working with lead even before they got married. After they got married, lead from their environment, food, entered the pregnant lady. It went, there's no placental barrier. The child got enough lead. Soon after its birth, it had convulsions, neurological problem, but it died at the age of 3 months. This is one instance. Another instance of 65-year-old man. He was preparing food at home. He had a grinder at home. His grinder had lead. Lead from the grinder came into his food, and he suffered from lead poisoning. It was he got into renal failure, eventually end stage renal disease, he died. These are the 2 extremes. In between this 2 age group, a lot of people are consuming traditional medicines, folk medicines, getting into lead poisoning. And unfortunately, we do not have in these countries, developing countries, centers to evaluate blood lead level. That is very much required. There is no way to find out how much lead is there in their blood.
In 2010, in Nigeria, there was massive lead poisoning in northern part of Nigeria, we call Zamfara State. It was huge. It attracted the attention of CDC. It attracted the attention of WHO. Some WHO staff and CDC staff were sent to Nigeria, and I remember I did a few things with them while they were here.
People in Zamfara State lost over 400 of their children to severe lead poisoning early on in the outbreak. And there's a cohort of children who survived that outbreak but have serious neurological and behavioural consequences. Plus, the background lead levels in Zamfara State are still quite high by international standards. So you've still got population level impact subclinically on a population that is already extremely disadvantaged and marginalized.
The case that stands out the most is it's a family of 3 generations that work with, they worked around the house with battery recycling. And adults, young adults and children had severe lead poisoning. Children required hospitalization and even chelation treatment. And one of the things that I remember most was that the family, the young people and the children had no education at all because they felt that they weren't able to learn. And they were convinced that they had a genetical disease, but never thought that lead could be culprit.
The WHO guidelines provide evidence-based information on the diagnosis and management of lead poisoning. They provide guidance on the management of lead poisoning in different age groups and poisoning with different degrees of severity.
The new WHO guideline will be a handy tool for physicians who are practicing in the sub-Saharan Africa.
It contains expert opinions of the practitioners from different countries, different parts of the world. You know, the facilities and tools for management of lead poisoning, for diagnosing lead poison cases, so they are different. All of these have been considered in these guidelines.
I think these WHO guidelines are really timely in producing evidence-based guidance to clinicians, public health bodies and policymakers to standardize the approach to this significant clinical issue.
The doctors who are treating the patients, they will have standard protocols from these guidelines, that how to treat, when to treat, and what antidotes should be given. So all that will be available in one place.
I think that the WHO guidelines will help stabilize the supply of the chelating agents. They're increasingly difficult to come by in the United States and in many other countries. And I'm hopeful that the countries will use the information on the chelating agents in the document to inform their decisions about which ones of these medications will be on their formularies.
Prevention is really important in lead poisoning, and I think we really need to stress that in those with a raised blood lead concentration, whilst treatment with medicines such as chelation therapy can be important, by far and away the most important aspect of management is identification and removal of the source of lead, and I think the guidelines get this across really well.
I think that these guidelines are very welcome for many a group of health professionals that are worried about lead poisoning, and also for those that are not aware that lead poisoning is a threat for children's and adult health.
So you've heard how important it is to not only prevent, and it's also important to manage the lead poisoning that occur. And early identification is key to proper management. Could we have the next slide, please? So in the end, I would like you to block your dates to visit Delhi from 2nd to 5th February 2023 for the 73rd Annual National Conference of Indian Association of Occupational Health, OccuCon 2023, which will be held in New Delhi and it will be organized by Association of Environmental and Occupational Health, Delhi. So you're welcome to Delhi. And the theme for this is workplace health, well-being, and environmental sustainability for future-ready organizations. Workplace health, well-being, and environmental sustainability for future-ready organizations. And you could visit for updates on this conference on our social media handles and the websites, and Enoch DigiConnect webinar, IOH Delhi, OccuCon, and OccuClave. OccuCon.com, IOHDelhi.com, and OccuClave.com. The three websites, and Facebook, Twitter, Instagram, and LinkedIn handles of our association. So in the end, I will remind you to connect once again on May 28, 2022. That is the last Saturday of May 2022 at 6:30 p.m. for an update on monthly basis with OccuHealthscapes. Thank you so much for your attention.
Thanks a lot, Dr. Rajiv. I think it was quite a lucid overview of different things which are happening. Really liked the one which talked about how lead is making an impact. Sometimes it feels very different to think about how it can affect the extremes of age groups. And I think it's a reality. It's something which is quite out there in the environment. Many of us might be involved or associated with people who are involved in these kind of recycling. It's about getting the awareness. It's about thinking that this is also a possibility. It's about getting the differential diagnosis that this might also need to be considered. And perhaps the most important thing is, how do we enhance the awareness, first of all, among the occupational health physicians, and then the medicine fraternity at large, so that we can have more amount of lead monitorings which happen as a routine. I think none of us would disagree that batteries, which are fairly common, along with other things which are out there, industrial fumes, everything is having lead in it, including tetrahydryl lead, which is also being used in the vehicles. It's just getting more and more dialogue out, more awareness. Absolutely. So it's about how do we make these awareness, and thanks for actually sharing insights on the different webinars which are also coming up. I hope most of us are able to use this information, participate based on our interests, and going forward, try to kind of introspect of what we can do better at our workplaces. So with that, let me open up for questions from any of our attendees.
Dr. Tyagarajan is there. If you want to make any comment, welcome.
Yeah, Dr. Tyagarajan.
Then Dr. Srinikit Mishra is also there.
Dr. Tyagarajan, I think let him go first, and then we'll have Dr. Srinikit.
Hello, sir. Good evening.
Good evening.
Today is actually a festival day. Yeah, it's a wonderful lecture. The moment I heard Dr. Venkatesh was telling the lead passing through the placenta and getting accumulated in the child, and later on had a convulsion, and later on the child died on his arms. Very pathetic to listen to that. And one of the slides which focused on how this negotiation in the Latin America, which has progressed into one of the best. They also started in 1947, afterwards independence, but Latin America like Brazil, Argentina, Chile, Peru has progressed to like anything. And you may see that they are the world champions in football and many athletics, and they have hosted the World Cup also, World Olympics also. Thank you very much, sir. Wonderful lecture. I think really a great lecture from you. And it's a very complimentary. And please, sir, please, this every last Saturday, please keep it up, sir. You are really highlighting so many things. And today I was thrilled by seeing, and really Dr. Venkatesh and Hazi, they are all wonderful, this one. And I kindly request you to post it today in this one. So let so many people go through this one. And thank you, Jain, for your wonderful moderating this one. And thank you very much.
I'm grateful for the time that you have spent in our Healthscape today. Dr. Venkatesh is very much from Bangalore, your city, and is still going younger. And it's good that he represented India in the global WHO guidelines on lead poisoning. Such a well-known figure globally.
Yes, sir. Yes, sir. And second thing is, sir, please see, ICO is coming, and yourself and Dr. Sharma, you are all the most important persons in that ICO. When we host in 27, you have to take a little bit part. And this is my request, humble request. Whenever this kind of meeting happens, because our Dr. Rajgopal, Dr. Shiva, Dr. Shamdwakji and Dr. Pingle, they are all busy working with various this one. Please invite them. Please give the moderator to personally invite these people to attend your seminar. I think a personal invitation should go to them because they are very busy. Because 2027 is not as easy because this one. And I also request to you all people, at least 1 or 2 weeks before, you should go to Makresh, to the way they organize. And our India should organize in such a way that it should be very globally, ours should be the forefront in the organization. It is my request, sir, to especially Jain, ji, as well as to our Sandeep Sharma ji. Please see that to be taken into forward.
We thoroughly value your advice and guidance, and we are working together for the journey to 2027 ICO Congress. And Marrakesh is just stopped. Marrakesh would be in 2024 May, and we shall continue to be together. In fact, today Dr. Rajgopal had some other engagement; he could not join. Dr. Sudha Ramchandran, she joined, and we keep on having a one-to-one contact on these webinars that we conduct, and it's a one team that goes through. If you had seen the webinar on World Day for Safety and Health at Work, Dr. Shanbag and Dr. Rajgopal were very much present throughout the session. So we continue to engage, and we shall continue this journey together.
Thank you, sir. Thank you very much.
Thank you, Dr. Tyagarajan. And I now have Dr. Sriniket. Would you like to share any comments, Dr. Sriniket? Dr. Parathaman from BML, would you like to share any thoughts or comments? Right. So perhaps it's reflection time, and thanks a lot to everyone for being out there on the Saturday evening. Thanks for spending your valuable time. With this, I would also like to now formally thank Dr. Rajiv for this wonderful presentation. We are looking forward to the May presentation, and in the meantime, as Dr. Rajiv said, please do have your registration for the upcoming at Delhi. Please also spread the word so that others can also register in time. Thank you so much. Have a lovely evening. Bye-bye.
Thank you so much. Thank you.